Your feet are trying to tell you something. 9 warning signs of diabetes you shouldn't overlook. Did you know that your body might have been sending you signals about diabetes for quite some time, and you've been overlooking them every single day? Long before any blood test is taken, and certainly before a formal diagnosis is made, the early indications might already be visible, quite literally, on your feet. What I'm about to share today has the potential to fundamentally change how you view your own health, possibly forever. Many people assume that diabetes can only be detected through a blood test. You visit your doctor, they send off some samples to the lab, and when the results come back, that's when you find out. I can absolutely understand why this is the common belief. For years, this was exactly what most of my patients told me as well. My name is Dr. Richard Ben, and I've dedicated over 2 decades to practicing medicine. What I've come to understand and what I witness confirmed in my practice on a weekly basis is that your body begins to signal elevated blood sugar levels much earlier than any laboratory result ever could. And remarkably, the very first place your body chooses to speak up about this is your feet. The primary reason I felt compelled to create this video today is due to the sheer number of patients I've encountered who have walked into my office, or even more concerning, into an emergency room, exhibiting clear warning signs for months and sometimes even years without ever understanding what they were looking at. My goal today is to change that reality for you. Just recently, I was speaking with a 67-year-old gentleman, retired and generally maintaining a healthy lifestyle. He felt perfectly fine. He came in for a routine checkup. However, before we even proceeded with any blood work, I inquired about the condition of his feet. He casually mentioned, "My feet have been a little numb for a while now. I just figured it was a normal part of getting older." As it turned out, he was displaying 4 out of the 9 specific signs I'm going to detail for you today. When his fasting blood sugar was finally checked, it came back at a concerning 214. He was indeed diabetic and had been for over 2 years without any awareness. Therefore, my aim today is to equip you with precisely the information I shared with that patient. I want to reveal 9 distinct signs that were present on his feet and are likely present on millions of feet right now, yet are almost universally unrecognized for what they truly signify. For each of these signs, I will explain what most individuals commonly attribute it to, what is actually occurring within your body, and a straightforward daily practice that can offer you protection. The American Diabetes Association estimates that a staggering 1 in every 5 individuals with diabetes remains unaware of their condition. This equates to over 8 million people currently living with a silent disease that is gradually damaging their nerves, their kidneys, their vision, and yes, their feet. The good news is that a relatively inexpensive blood test, often costing around $12, can detect this condition in its early stages. However, the crucial first step is knowing what signs to look for. So let's delve into them. The first sign, a tingling sensation. Sign number 1 is something that nearly every patient I've spoken with has experienced, and every single one of them has found a way to dismiss it. It's that peculiar tingling, numbness, or the pins and needles sensation in the feet. My patients almost invariably tell me, "Dr. Ben, my foot just falls asleep sometimes. I must have been sitting with my legs crossed." And while that is indeed a common occurrence for everyone occasionally, I always follow up by asking, is this happening with any regularity or without a clear and obvious reason? Because if the answer is yes, then we absolutely need to discuss what might truly be going on. Frequent, recurring numbness or tingling in the feet, a condition doctors refer to as peripheral neuropathy, is one of the earliest indicators that your blood sugar levels have been elevated for an extended period. The excess sugar circulating in your bloodstream begins to attack the delicate outer protective layer of your nerves. This is a gradual process, which is precisely why most people miss it. I often use this analogy with my patients. Imagine your nerves are like electrical wires. Each wire is encased in a plastic coating, which is essential for allowing the signal to travel clearly from your brain all the way to your foot. When your blood sugar consistently remains high, it's akin to an acidic substance slowly corroding that protective coating. The wire will continue to function for a while, but the signals it transmits will start to become less clear and more distorted. That distortion, that fuzziness, is the tingling sensation you feel. According to the American Diabetes Association, peripheral neuropathy affects nearly 50% of individuals diagnosed with diabetes. It stands as the single most prevalent complication, and it almost invariably begins in the feet. This means that at this very moment, tens of millions of Americans are likely experiencing this tingling sensation and are dismissing it as insignificant. Please do not be one of them. My daily recommendation for all my patients over the age of 60 is straightforward. Engage in a 20 to 30-minute walk every single day. This doesn't need to be a strenuous jog. A simple walk will suffice. Movement is the most beneficial activity you can undertake to promote blood flow to your feet and safeguard those vital nerve endings. Additionally, make a conscious effort to start reducing the amount of added sugar in your diet starting today. Not next week, but today. The second sign, a burning sensation. Sign number 2 is one that my patients often describe as the most distressing of all, primarily because it doesn't manifest during the day when there are distractions. Instead, it strikes at night when they are alone and trying to rest, and there is nothing to divert their attention from it. Many of my patients attribute this to simply being on their feet all day, or perhaps the summer heat, or just general fatigue. And at times, that is indeed the case. However, when a patient tells me their feet feel as though they are on fire, especially at night when they are lying down, I take that symptom very seriously. A burning sensation in the soles of the feet, particularly during the night, is a classic early sign of diabetic neuropathy. What is happening is that the nerves in your feet have sustained damage due to the presence of excess sugar, and they are now sending inaccurate signals to your brain. Your brain is receiving a sensation of heat even though nothing hot is actually in contact with your foot. Essentially, the nerves are misfiring. Think of it like a fire alarm system that has a faulty sensor. The building isn't actually on fire, but the alarm is sounding because the sensor itself is damaged. Your nervous system is experiencing a similar malfunction. The burning sensation is not originating from outside your body. It's a manifestation of damaged nerve tissue within, crying out for assistance. Research published in the journal Diabetes Care has indicated that burning foot pain is among the very first symptoms reported by patients who are later diagnosed with type 2 diabetes, often appearing 1 to 3 years prior to a formal diagnosis. For this particular sign, I recommend 2 daily habits. Firstly, ensure you are drinking at least 8 glasses of water each day. Proper hydration assists your kidneys in flushing out excess glucose and provides essential support for nerve tissue. Secondly, incorporate more fiber into every meal you consume. This includes plenty of vegetables, legumes, and oats. Fiber plays a crucial role in slowing down the absorption of sugar into your bloodstream, which is exactly what those compromised nerves desperately need. The third sign, slow healing wounds. Sign number 3 requires your very close attention because this is the one that transitions from being merely uncomfortable to becoming genuinely dangerous. This is the symptom that leads the most patients to seek emergency medical care. They will arrive and say, "Dr. Ben, I had a small blister from my shoe about 3 weeks ago. It still hasn't healed." They have waited, assuming it would simply close up on its own. While most minor wounds do indeed heal on their own, this is not the case when your blood sugar levels are elevated. When your blood sugar remains consistently high, your body's innate ability to heal itself becomes significantly impaired. The blood vessels throughout your entire body, including the very small ones within your feet, begin to narrow and stiffen. This means that vital components like oxygen, white blood cells, and the nutrients necessary for tissue repair are simply unable to reach the site of the wound quickly enough. The wound then remains open, exposed, vulnerable, and stubbornly slow to close. Imagine attempting to water a garden, but your garden hose has a severe kink in it. The water is present, but it's not reaching where it needs to go. This is precisely what elevated blood sugar does to the circulation in your feet. The essential healing elements are present in your blood, but they are hindered from reaching the wound. And an open wound that refuses to close is essentially an invitation for infection. The Centers for Disease Control and Prevention reports that diabetic foot ulcers are the leading cause of non-traumatic lower limb amputations in the United States, accounting for over 100,000 such procedures annually. Almost all of these amputations were preceded by a small wound that went unaddressed. After your bath or shower this evening, take the time to carefully examine both of your feet. Pay close attention to the spaces between each toe and thoroughly inspect your heels. If you notice any cut, blister, or broken skin, clean the area gently with mild soap and water. Apply an antiseptic and cover it with a bandage. If there is no noticeable improvement within 48 hours, it is imperative to contact your doctor. Not next week, but within 48 hours. The fourth sign, skin discoloration. Sign number 4 is one that is hiding in plain sight. Most people walk past it on a daily basis without ever recognizing its significance. It is visible, it has likely been present for some time, and very few people connect it to their blood sugar levels. Patients often observe their feet turning a darker or more reddish hue, and they will explain it away by saying, "I believe it's just sun damage," or "I've always had darker skin on my ankles." While that might be true in some instances, there is a distinct pattern of discoloration, particularly around the ankles, that I specifically look for when assessing someone's risk for elevated blood sugar. When circulation becomes compromised due to high blood sugar, the lower legs and feet do not receive an adequate supply of fresh, oxygenated blood. As a consequence, the skin begins to change color. You might observe a darkening, a deep red, or even a bluish tint around the ankles. This is your skin's way of indicating that blood flow to that particular region is insufficient. In some individuals, the skin in these areas also becomes noticeably thinner and more fragile. This is another indication that the tissues are not receiving the nourishment they require. I always explain this to my patients using the following analogy. Imagine your blood as a delivery truck responsible for transporting oxygen and essential nutrients. Your feet are situated at the very end of the longest delivery route in your body, being further from your heart than any other extremity. When the roads, your blood vessels, become narrowed due to damage from high blood sugar, the deliveries begin to fall behind schedule. The skin, starved of fresh oxygen, changes its color. It's a visible distress signal that you can observe with your own eyes, provided you know what to look for. A study published in the Journal of the American Academy of Dermatology found that these subtle skin changes are often detectable an average of 18 months before a formal diabetes diagnosis is made. The daily habit recommended for this sign involves just 5 minutes each morning dedicated to performing ankle circles, toe raises, and calf stretches. Even this small amount of movement is enough to encourage blood flow into your feet. Furthermore, if regular exercise is not feasible, simply elevating your feet slightly while you are seated can make a significant positive difference. The fifth sign, cracked heels and dry skin. Sign number 5 is one that consistently surprises my patients the most, primarily because it appears entirely harmless. In fact, many people have experienced this for years without ever connecting it to their blood sugar levels. They often say, "Dr. Ben, my heels crack every winter. It's just dry skin." I hear this remark constantly, and yes, that is indeed a very common issue. However, when your heels are cracking significantly in the middle of summer, or when no amount of moisturizer seems to provide relief, regardless of how much you apply, that presents a completely different scenario. Diabetes has a profound impact on the autonomic nervous system, the system that controls involuntary bodily functions that you don't consciously think about. One of these crucial functions is the regulation of moisture and sweat production in the skin. When these nerves become damaged, the sweat glands in your feet begin to malfunction. Consequently, your feet lose their natural moisture from the inside out. Applying lotion externally cannot address the root cause of this issue. Visualize your skin as a protective wall that needs to remain sealed. When those autonomic nerves are compromised, it's as if the mortar between the bricks starts to crumble. This leads to the formation of cracks. And these cracks in the skin of your feet are not merely a cosmetic concern. They represent open pathways for bacteria and potential infection. In a foot that already suffers from compromised circulation, an infection can escalate very rapidly and become extremely serious. I have had patients present with cracks in their heels so deep that they were bleeding, and yet they reported having applied lotion to the area for 2 years with no success. This is not fundamentally a skin problem, it is a nerve problem. The American Podiatric Medical Association identifies chronic, difficult-to-treat heel cracking as a significant indicator of autonomic neuropathy in seniors, a condition that is directly linked to long-term elevated blood sugar levels. Autonomic neuropathy is far from a minor inconvenience. It is a clear signal that your nervous system is under considerable strain. My daily recommendation here is to moisturize your feet thoroughly every single night before you go to bed. A high-quality lotion or pure coconut oil works very effectively. Apply it generously to the sole and heel of your foot, but make sure to avoid applying moisturizer between your toes, as trapped moisture can create an environment conducive to fungal infections. Additionally, continue to drink those 8 glasses of water daily. Your skin requires hydration from within just as much as it does from the outside. I would like to pause here for just a brief moment. We have now covered 5 distinct signs, and I want to pose a direct question to you. Have you noticed any of these signs in yourself, or perhaps in someone you care about dearly, a spouse, a parent, or a sibling? If your answer is yes, even if it's just one of the signs, please take a moment to go down to the comment section right now and type the word yes. Just yes in capital letters is all I need. I make it a point to read every single comment on this channel. And for everyone watching, if you have a question, please don't hesitate to ask it. If you have a concern, share it with me. This is precisely why I established this channel. Not to simply talk at you, but to engage in a meaningful conversation with you. And if you are finding this information useful, please hit the like button right now. It takes just 1 second and it signals to YouTube to show this video to more seniors who can benefit from it. Alright, let's continue our discussion. The 6th sign, swelling in the feet and ankles. Sign number 6 is more serious than most people realize, not just because it affects your feet, but because it often indicates what is happening to your kidneys simultaneously. Almost everyone I've encountered with this symptom tells me, I sit at my desk all day, or I stand on my feet at work. Occasional swelling due to prolonged activity is perfectly normal. I want to be clear about that distinction. However, if your feet and ankles are persistently swollen, and you find that your socks are consistently leaving deep indentations by the evening, that fundamentally changes the picture. High blood sugar levels have a detrimental effect on the kidneys. The kidneys, in turn, are responsible for regulating your body's fluid balance. When kidney function is compromised due to years of elevated glucose levels, excess fluid can begin to accumulate in the lowest parts of your body, your feet and ankles. This swelling, medically known as edema, is a sign that your body's internal filtration system is under significant stress. Imagine your kidneys as the primary filtration plant for your entire body. Every single drop of your blood passes through them to be cleansed. When high blood sugar damages these delicate filters, the system essentially backs up and excess fluid has nowhere to go but downwards. Gravity then does the rest, causing the fluid to pool in your ankles. If you press your finger into the swollen area and the indentation remains for a few seconds, this is referred to as pitting edema, and it is absolutely not something to be ignored. The National Kidney Foundation reports that diabetic kidney disease affects approximately 1 in 3 adults with diabetes, and lower extremity edema is frequently the very first visible sign that kidney function is being impaired. When you are resting, try to elevate your feet above the level of your heart, even just a few inches using a pillow. This action helps to encourage that accumulated fluid to move back towards the center of your body. Additionally, actively reduce the amount of sodium in your diet. Salt causes your body to retain water, which significantly exacerbates swelling. Always read food labels carefully, as many canned and processed foods are loaded with hidden sodium. And if the swelling is new, persistent, or progressively worsening, please make sure to bring it to your doctor's attention at your next appointment. Do not delay until it becomes a more significant problem. The The seventh sign, pain that's not arthritis. Sign number 7 is one that I observe being most frequently misdiagnosed. Men in particular often live with this condition and try to manage it for years before realizing its true origin. The majority of my senior patients are male, and what I hear from them, almost without exception, is this: I've been taking ibuprofen for my foot pain for months. I just figured it was arthritis, or perhaps an old sports injury. I have heard this story dozens of times, and sometimes that initial assumption is indeed correct. However, there are instances where the pain stems from an entirely different source, one that ibuprofen will never be able to address. When nerves become damaged due to chronic high blood sugar levels, they don't always simply go quiet. In some cases, they become hypersensitive and erratic. Instead of becoming numb, they start sending out random, intense signals that your brain interprets as severe pain. Patients often describe this as stabbing pain, like an electric shock, or as if a hot needle is being driven through their foot. This phenomenon is most common at night, when there are no other sensory distractions to occupy the mind. Think of a car alarm that has been damaged in a minor collision. Every few minutes, it starts blaring loudly for no apparent reason. No one is attempting to break into the car. The alarm system is simply malfunctioning. This is what a damaged nerve can do. It sends alarm signals to your brain even when there is no actual external threat. The pain is entirely real, but its origin lies in nerve dysfunction, not in a physical injury. And taking ibuprofen, while it might mask the pain sensation, does not fix a damaged nerve. Instead, it merely suppresses a critical signal that your body is desperately trying to send you. Suppressing these signals is the very last thing you want to do when your nerves are signaling for help. A groundbreaking study published in the New England Journal of Medicine found that painful diabetic neuropathy affects approximately 25% of individuals with diabetes and is frequently mistaken for common ailments like arthritis, tendinitis, or age-related joint pain. To help manage this, I recommend dedicating 5 minutes each morning to gentle foot and ankle stretching before you even get out of bed. Flex your feet, rotate your ankles in circles, and gently pull your toes back. This process helps to get your blood moving before you put any weight on your feet. And every night before you go to sleep, give your feet a gentle massage. Using light circular strokes along the sole of your foot and up towards your ankle can be very beneficial. Your nerves will undoubtedly thank you for it. The 8th sign, consistently cold feet. Sign number 8 is the one that truly tells me how far a condition has progressed. When I observe this particular symptom in a patient, I understand that the damage is no longer in its early stages. And almost without fail, the patient's initial reaction is, "Doctor, I've had this my entire life." They will say, "My feet have always been cold, Dr. Ben. My wife has been stealing the electric blanket every winter for the past 30 years. And while I might share a laugh with them, I then proceed to ask a crucial follow-up question. Are your feet still cold in the middle of July? Are they cold even when you're using 3 blankets? Because it is in these circumstances that I become truly concerned. Cold feet that persist regardless of the ambient temperature, feeling cold even in the summer, cold under heavy blankets, and even cold when the rest of your body feels comfortably warm, are a strong indicator of significantly impaired blood circulation in your lower extremities. Your blood vessels have narrowed or stiffened to such an extent that warm blood is simply not reaching the extremities of your feet in sufficient volume. Visualize your blood vessels as the heating pipes in your home, delivering warmth to every room. When those pipes become narrowed due to damage from elevated blood sugar, the heat cannot reach the furthest points. Consequently, the room remains cold, no matter how hard the furnace is working. That cold sensation is not about the weather outside, it's about the condition of the pipes within. The American Heart Association identifies peripheral artery disease, which is caused by narrowed blood vessels, as affecting over 8 million Americans, with diabetes being the single most significant risk factor. Cold feet are consistently one of its earliest and most prevalent symptoms. The most effective response in this situation is to engage in a 30-minute brisk walk every single day. This should not be a leisurely stroll, but a purposeful walk with arm swinging. This activity actively drives blood circulation into your feet and lower legs, strengthens the walls of your blood vessels, and over time can even reverse some of the initial narrowing. If 30 minutes feels like too much to start with, begin with just 10 minutes. The most important thing is to start today. The 9th sign, loss of hair on lower legs and feet. Sign number 9 is the one that almost nobody ever discusses. It's a sign I have never seen featured in a patient brochure, and most people, including many medical professionals, simply overlook it. However, once you become aware of it, you will never unsee it. I rarely need to bring it up myself because patients seldom notice it on their own. But during a thorough foot examination, when I observe the lower legs and the tops of the feet, I sometimes notice a visible absence of hair in those specific areas. The patient will then look down and remark, I never noticed that before. And that is precisely the problem. It is a subtle sign, easily missed, but it carries significant meaning. Hair follicles require a consistent supply of blood and oxygen to function properly. When circulation is significantly compromised due to long-standing elevated blood sugar levels, the follicles in your feet and lower legs gradually stop receiving the essential nutrients they need. Over time, they cease producing hair altogether. That loss of hair is a visible marker of blood vessel damage that has been progressing in many instances for years. Think of hair follicles as small plants in a garden. When the irrigation pipe becomes narrowed or blocked, the plants don't die instantaneously. They simply gradually stop growing. The absence of growth is your body's way of communicating vital information about the health of your blood vessels. It's a message you can see every single time you look at your legs. Research published in Diabetes, Obesity, and Metabolism found that hair loss on the lower extremities correlates significantly with peripheral vascular disease in diabetic patients. It is considered a reliable and frequently overlooked sign that physicians are specifically trained to look for. Immediately after watching this video, I urge you to examine the lower part of your legs and the tops of your feet. If the hair in these areas appears significantly thinner than the hair on the rest of your leg or is entirely absent, please schedule a blood glucose test this week, not this month, but this week, for approximately $12 at any certified lab and often covered by Medicare for many individuals. This small cost can entirely alter the trajectory of your health. We have covered a significant amount of information today, detailing 9 distinct signs, 9 opportunities to identify a potential issue before it identifies you. I want to be completely honest with you about something. One of the most challenging aspects of my profession is sitting across from a patient who has exhibited every single one of these warning signs for 2 years, only to be discovering the reason for them now. This isn't because they didn't care. They cared deeply. They simply lack the necessary information. You now possess that crucial information, and I implore you to do one thing with it. Just one thing. Tonight, before you go to bed, take a moment to sit down and truly examine your feet. Dedicate just 30 seconds to this. Look at the skin. Pay attention to the spaces between your toes. Feel for any numbness. Check for any wound that seems out of place. 30 seconds is all I ask. And if you observe or feel anything on this list, please call your doctor tomorrow, not next week, tomorrow, because the earlier this condition is detected, the more effectively and completely it can be managed, often through simple changes in diet, a commitment to daily walking, and a focused conversation with your healthcare provider. You have worked diligently to build the life you have, your independence, your health, your ability to pursue the activities you love. Do not allow something as manageable as blood sugar levels to rob you of any of that simply because you were not informed about what to look for. Now you know. If you found this video to be beneficial, please share it on Facebook right now. Tag someone you care about, a family member, a friend, a neighbor. You might be providing them with essential information they didn't even know they needed. And if you desire more conversations like this one, I release a new video every week on this channel, focusing on topics that are vital for your health after the age of 60. These are the kinds of important discussions I have with my patients that most people never hear outside of a doctor's office. Please subscribe and bring someone you love along for the journey. I am Dr. Richard Ben. Remain aware, stay proactive, and take excellent care of those feet. I look forward to seeing you in the next video. To stay connected with me, please subscribe. Thank you.